Nearly a year after Denver Health Medical Center received its first COVID-19 patient, the head of the intensive care unit here is feeling reflective.
Well, I think that the American pandemic has been a uniquely American phenomenon.
Dr. Ivor Douglas says it's demonstrated both the technological capabilities of this country's healthcare system and the racism in U.S. society that have alternately saved and cost lives. The pandemic, he adds, struck like a tsunami for which we were ill prepared.
I certainly, at a personal level, felt most drained and inadequate and humbled about our challenges. We've made accommodations.
We first met Douglas virtually last April as he coped with delays in the testing of patients for the coronavirus and confronted this menacing new disease.
This is personal, this is invasive, and it's invisible.
In November, he spoke about pandemic fatigue and pleaded for people to avoid in-person gatherings right before a new surge of cases.
A Thanksgiving over Zoom is far preferable to a Christmas in my ICU lying on your stomach on a ventilator.
Now, just 2 patients infected with COVID-19 lie in his ICU. Instead, the ward is full of people with drug overdoses, cold exposure, and heart disease that's gone untreated. Douglas says the pandemic has laid bare America's lack of a robust social safety net, as well as the shortage of healthcare workers and vital drugs, and the difficulties hospitals face handling a sudden surge of patients. He says it's time for leaders to address what's broken in healthcare today.
I actually think we're at a transformative moment. Would that have happened without COVID-19? I don't know the answer, but I suspect probably not.
Douglas says the pandemic tested him and his colleagues in ways they couldn't have imagined. He's grateful to those in his profession who put their lives on the line.
I would never assume that I knew what a war zone was because I've never been in the military. But if I could imagine what a civilian war zone looks like, this is as close as I could imagine.
He thinks about certain patients, whether they could have been saved.
And sadly, and there's one family that sticks with me forever, where 4 members of the family were in the hospital at the same time and 2 died.
He thinks about the isolation felt by those he treated.
To have the number of patients die alone that I have had the burden and responsibility to care for, I think will be the thing that sticks with me forever.
He hopes lessons can be learned from this difficult year and applied to future pandemics he believes are inevitable. He is cautiously optimistic that can happen. Hendrik Sybrandy, CGTN, Denver.